Deep and wide reputation in the area of public health and speech language therapy, working with literacy, working with youth in the justice system. She is much published and works currently in the Faculty of Medicine at Monash University, Bendigo in Australia, and has a great deal to do with training doctors to become communicators. There's a task. So, welcome Pamela, and we very much look forward to your presentation. Sorry.
No, you're fine.
A bit slow at this.
Right. Thank you, Linda. Thank you for that very warm welcome, and to Claire and Sally. I just want to tell you all how incredibly fortunate you are to have these three energetic movers and shakers right here in New Zealand, because I think already New Zealand's punching above its weight in this area, and there's going to be the space to watch. So it's been a real privilege this week to be here conferring with such energetic and interested and inspiring colleagues, and it's certainly been a two-way street. I'm going away with lots of ideas and resources and leads to follow myself, so it hasn't at all been a one-way street. I was smiling to myself when Linda was referring to the work that I do with medical students and teaching communication skills. There are days when I think medical students, young offenders, now remind me again, what's the difference? Believe me, there are days. And sometimes I know which is the easier group to work with. I wish we could lock up the medical students sometimes. This is being recorded, isn't it? So I better stop at that point.
I'll edit that bit.
Yeah, you better, yeah. Okay, so, well, first of all, I feel that I need to kind of prospectively apologise to anybody who heard me yesterday. It's kind of an acceptably social faux pas to bore people once. It's not acceptable to bore them twice. So you will hear some, if you were here yesterday, you will hear some of the same content, but it has a different kind of spin and emphasis, I guess, today for this particular audience. And it's always a particular pleasure for me to kind of come home to a speech pathology audience, because there's a lot of concepts and ideas that I don't need to spend a lot of time kind of unpacking and decoding. But my message when I talk to speech pathologists, I guess, is to try to hone your meta-awareness, so your awareness of what you know that's special, that what you bring to the table that is unique, and to get you thinking about some of your specialist areas of knowledge and skill and how these can be applied for this particular vulnerable population that we're talking about today, but also to get you thinking about the sell that you have to do to other people sometimes who don't always, for perfectly good reasons, don't always understand the particular skill set that speech language therapy, speech pathology brings to the table. So I need to acknowledge, of course, our funding bodies, my co-investigator in this work, Martine Powell, our fantastic, dedicated research assistants, and I should actually list there Mary Woodward, who is the British-born SLT who's working with us at the moment on our New South Wales project. So I need to update my slides and include Mary, because she's doing a fantastic job. She is also in the UK a registered intermediary, and so she's been sharing some of her expertise around that with us in Australia. And of course the relevant government departments and the many young people themselves now who've taken part in our research. We're deeply grateful to all of them. So what I will do in the next little while is talk to you, and you know, they say that the definition of a consultant is somebody who tells you the time on your watch, and you've got to pay them for the privilege of that. So some of what I'm doing is telling you the time on your watch, because I'm telling you stuff that you already know, but I want to encourage you to think about it in a different way, and to perhaps value your specific expertise a little more highly than you might already be doing. So we'll talk about language competence, what it is, why it's important, a little bit about vulnerable young people and the developmental trajectory associated with risk and educational disengagement. Have a little revisit of some of the evidence on language competence and the social gradient, a bit about our research in particular on young offenders. I'll tell you a bit about the OLSAL trial in Victoria, which, as you'll see, stands for Oral Language Supports Early Literacy. I should say too that I'll make copies of the PowerPoint presentation available to you via Sally and Linda and Claire, so don't feel that you need to slavishly be taking notes. And then have a think about what this means for implications for young people in the youth justice system, and how speech-language therapy, speech-language pathology can continue to reposition itself and assert itself really around some of this evidence. Now, there are different ways that we can talk about young offenders. There are different perspectives that we can take on this group. We can talk about them as a clinical entity, a clinical group who are of interest to us for some important intrinsic reasons. There are reasons that we all know and understand about why we might expect young people in the youth justice system to have compromised language skills. They tend to come from fairly chaotic backgrounds, and we'll touch more specifically on some of those issues in a little while. But I think you would intrinsically agree with me that they are a clinical population who are worthy of study in their own right. We can find out more about their language skills, and we can look at ways of improving their lot, because that's an advocacy role for this profession, isn't it? To talk to people in other professions, to ease the passage of these young people through the justice system, and hopefully try to advocate for appropriate services, and indeed to provide some of those services as well. So that's a kind of a fairly circumscribed role, and a reason for why we would want to study the language skills of young offenders. But I think there's a deeper, wider, more complex reason for us to be looking at this group, and that's to find out what they can teach us about where our systems are working well and where they're not working well. Because for a young person to become engaged in the youth justice system means that the balance between protective and risk factors in their lives is not as it should be. If we think of risk and protective factors as being as operating at the level of the individual, at the level of the family, the school and the community. So there are a number of systems, a number of policy frameworks around those concentric kind of rings. And when we look at young people who kind of fall by the wayside and fall off from our system, I think they can teach us a lot about where we have gaps in our safety nets and our service delivery and our understanding of vulnerability and our identification of young people who are on a risky trajectory, in many cases, I guess from the moment of conception, if not birth. So I do think that research on young offenders stands to tell us a lot about what we're doing well, but what we're not doing well. We can't just look at successes. We also need to look at well, I don't like to use the word failures because that kind of characterises the young people themselves, but they're not our successes when they depart early from education and become involved in antisocial activity. So I want to invite you to think about this thing that we all kind of take for granted called oral language. We know that it's the thing that separates us from the primates. You know, we share something like 99 point something % of our DNA, don't we, with the primates? But but really language is one of the things that really clearly differentiates us from that other species. We can think of it in a very modular kind of way, around semantics and syntax and morphology and phonology and pragmatics, and we have to think of it in that way in order to understand it and identify where it's working well and not working well. But we can also think about ways of communicating to other people about the importance of oral language competence in everyday life, because language is the tool that is used, that we all use, to navigate our way through our everyday lives. Whether it's spoken language, whether it's inner thought, us verbalising to ourselves, as I was doing, as I came down here, and I was talking to Carolyn as I came down, and I was thinking, now I think I came down these stairs, and I think I turned left here, because I came down all by myself without my minders from upstairs. So language guides and mediates our behaviour. It's not just the thing that we use for social communication. And it's very easy for us, I think, as specialists in the area, to overlook the fact that not everybody else thinks about language as being a two-channel process, that having an expressive and a receptive channel. So we've done half of our job if we've got other people thinking about language competence with respect to a young person's ability to express themselves, but we've only done half of our job if they're not also recognising that, even for me now as I'm talking to you all, I have no way of knowing who's listening. You all look like you're listening, but then you're SLTs, so I know you know how to look like you're listening. But I have no way of knowing who's actually processing, taking in, paying attention. You're not in the right places, and you display attentive behaviours. And so it's very important in our conversations with practitioners in other disciplines that we really convey this message that language is a two-channel process. It's great to get them thinking about the young person's expressive skills, but it's not enough. So language competence then is something different from language, because most of us have language to some extent, but there's a high degree of variability in a given population around the degree of competence with which people can navigate their way around language and use language to negotiate their way through the business of everyday life. Language competence, as you know, is one of the strongest clues as to who we are. When I start talking, you can start forming all kinds of probably quite accurate hypotheses about who I am, not just the fact that I'm not from around here, but you can formulate hypotheses about, we like to think in Australia, and I imagine you like to think this in New Zealand, that we're classless societies, but we're not classless societies. We make assumptions about people from the way that they speak. So in that sense, language competence is socially determined and also somewhat deterministic. Language competence reflects a wide range of early developmental factors and experiences, and I'll touch a little bit on this in a moment. The importance of early secure attachment experiences just can't be overemphasised, because language, that provides the context in which early language exposure and the development of empathy occurs. And I'll talk a little bit about scaffolding. I love this term that one of my colleagues at Monash, Professor Louise Newman, uses. She's a child psychiatrist. In fact, her area of specialty is infancy. And she refers to parents as external neurobiological regulators. So you can go home and tell your children that if they're external neurobiological regulators home, so they better clean their bedroom. But when you think about it, that really is what parents do for infants and young children who are not able to regulate their own affective state. They need to have the kind of remote control, if you like, from someone who is warm and affectively tuned into them, and gradually withdraws that support as the child develops some fledgling abilities to manage their affective state on their own. And affective state and communication map over each other pretty closely when it comes to adolescence and young people violating social norms and getting in trouble with the law. Language competence is also closely tied to social cognition, which, as you know, is our ability to draw inferences about other people's emotional and mental states from micro changes in facial expression, from prosodic features, from body language, bearing in mind that we are all socialised in childhood to play against our emotions in many social situations. So we're taught that we might be feeling bored, for example, but we have to look interested. That we might be feeling disappointed, but we have to look happy for the other person who got what they wanted, even though we didn't get what we wanted. So, but as humans, we're pretty good at working our way around those attempts to play against our emotions. Some of us can be quite good at it. And you know, all of us in a professional sense have, you know, sometimes had to go to work when we were not feeling all that bright and chirpy because of things that were happening in our lives, and we can kind of put a mask on and you know, do what we need to do. But people really close to us might come and say, you know, you don't quite seem yourself today, you know, is everything okay? So as humans, we are wired to tune into those subtle messages that we throw out sometimes, whether we want to throw them out or not, to those who are astute enough to tune into them. And of course, as children develop, we expect them to become more sophisticated in the way that they use their language and communication skills, and we expect them to observe a raft of sometimes confusing social conventions that they only learn by violating. And we've all had that experience, haven't we, of learning a social rule by breaking it, by going into a situation and mentioning something that shouldn't be mentioned in that situation and inadvertently causing offence. Again, as you know, linguistically competent people can move beyond surface meanings to deep and metaphorical meanings, and I'll give you some examples of those in a moment. And being linguistically competent in the early years of life is profoundly closely tied to the capacity to cross the bridge to literacy in the first 3 years of school. And again, we'll visit some evidence on that. Now, a couple of weeks ago, as you no doubt know, the Nobel Prizes were awarded, and I was really hoping that the phone would ring and they'd tell me that I'd won one for this triple helix that I've been talking about of late, but apparently it's not that important in scientific circles. But for me, if there was a triple helix that applied to speech pathology, speech language therapy, this would be it. It would be that intrinsic early relationship between language, empathy and affect regulation, because they're the things that wrap around each other when attachment experiences work well, which, you know, most of the time they do. You know, at a population level, most of the time they do. But for vulnerable young people, in many cases, this is where things start to unravel quite early in their lives. When you look at the degree of mutual engagement there between mother and child, and the degree of mutual fascination and wonder, you can see that that's a really fertile space, not only for language, but also for the development of empathy and attunement, and for the reins to be gradually handed from mother to child over a period of years, of course, around regulation of affective state. So we would expect a mother of a 1 or 2 week old infant who starts crying to respond, you know, fairly quickly and with a fairly high degree of focus, whereas a mother of a 9-month-old child who starts crying, we would expect that she can call out, the child can hear her voice from the other room and hear her saying, it's okay, I'm coming, and begin to be soothed just a little bit by hearing the mother's voice, so that the affect regulation reins are beginning to be handed over. If any of you have never seen it, I would commend to you to go home and Google, go onto YouTube and find the still face experiment. Have any of you seen the still face experiment? It's well worth having a look at. It'll take 2 minutes of your time, and it shows what happens to an infant when in a positive mother-child relationship when the mother, just for a minute, freezes her face, and a level of distress and agitation for this 12-month-old child, because infants need to have this constant engagement with their caregivers. I think it's important for us to also consider the role of early life experience on what's happening neurobiologically in the human brain, and the fact that early life experiences sculpt the formation of early neural pathways. So the human brain at birth is a fairly kind of chaotic collection of neurons that need to link up with each other through experience. Pathways need to be formed in much the same way that we form pathways through sand dunes by walking the same path over and over again. So experience creates neural pathways. Experience doesn't always create good neural pathways if a child's having negative experiences. Now this is a fairly profound image here that shows the effect of extreme neglect on development, and you can see that this has affected not only physical development, and you can see that from the size of the skulls and the brains, but you can see, you don't have to be a neuroradiologist to see that there are significant structural implications for the brains of these two children as a consequence of their early life experiences. So what happens in the first 4 years of life is obviously profoundly important, but that doesn't mean, as I'll emphasise later on, that we should be abandoning hope when we're dealing with adolescents. Now, I mentioned before the idea of scaffolding, and if you go back to your undergraduate teaching, you might recall reading the works of Lev Vygotsky, the Russian developmental psychologist who died far too young. I wonder what else he would have given us if he'd lived beyond his 30s. He gave us two really important concepts that I think are still profoundly important, and that we need to think about not only in relation to typical development, but also in relation to the development of vulnerable young people, and this idea of scaffolding. If you think of the role of scaffolding on a building, it's to keep a building site safe while it's under construction, and it can be gradually withdrawn. And of course, in ideal circumstances, that's what parents do and teachers do, isn't it? They provide the right amount of scaffolding, and as children develop skills, they gradually dismantle the scaffolding. Sometimes scaffolding has to be put up again temporarily in certain situations to deal with certain challenges, but in general we have an assumption that once the building underneath is complete and fairly solid and can stand in its own right, that we'll take the scaffolding away. And I think it's a very helpful concept for us in thinking about how we might approach working with young people, in the justice system, in terms of what scaffolding might need to be put in place to help them with some of their developmental tasks. And Vygotsky also gave us this idea of the zone of proximal development. Another very helpful concept, I think, for thinking about skills and capacities that children have at this point in time. What are the skills and capacities that are just outside that, so they're in that zone of proximal development, and there are other things that are just too difficult that the young person, the child, can't do at this point in time. So an important therapeutic framework and developmental framework. Now, I said before that competent language users need to be able to move beyond the level of surface meaning and deal with the raft of metaphorical and non-literal linguistic devices that we will use every day. Because, as you know, our everyday communication would be really boring if we only ever went around operating at a literal level. How dry would everyday communication be if when somebody said, excuse me, can you tell me the time, the expected response was, yes, I learned that when I was 5. That's just not how we operate. There are all sorts of ways in which we manipulate language and meaning to make it more interesting, to make it culturally appropriate, socially appropriate, and to have fun in our interactions with each other and our reflections on the world. Now, some of those operate at a quite literal level, like similes. So, when we say something's as cold as ice, that's not too linguistically or cognitively challenging, provided you've ever been exposed to ice and what, the fact that it's very cold. But innuendo, implicature, someone wanting to borrow something from you but not wanting to directly ask might tell you that it's really inconvenient that their car's in for a service and they need to get the train to work. Now, if you're not operating at a non-literal level, you're going to say, oh yeah, that would be a bit of a pain. You're not thinking, oh well, look, I go a fairly similar way to you. Perhaps I could give you a lift, or you could recognise that there's actually a politeness convention being used there, where the person's kind of putting out feelers and seeing whether you might perhaps be prepared to offer some assistance. And of course, that depends too on the degree of social distance between the two speakers. If it's someone who is at a fairly similar hierarchical level to you, then you might be comfortable to say, look, my car's in for a service, can you give me a lift, or is it okay if I have a lift with you? But we have to use more subtle devices depending on the social relationship. Idiom, jokes, it's always wonderful with typically developing children when they get to that age around I suppose it's around 7 or 8 when they start to enjoy knock-knocks, and they get this idea that language can be manipulated and can create unexpected outcomes that make people laugh. Sarcasm's very tricky because, as you know, it involves saying the exact opposite of what you mean, but expecting the linguistic inversion to occur in the other person's head, but they've also got to take in a whole lot of contextual information as well. Analogy and irony, and there are others as well that we expect young people to begin to be competent with as they move from primary to secondary school. This is stuff that we all kind of intrinsically know. It's this distinction between surface and deep meaning of language is not something that is intrinsically known by other practitioners. It's not intrinsically known by teachers, for example, and we can't expect teachers to know everything, but it can sometimes help explain breakdowns in communication when we look at how language is being used in classroom situations. Increasingly, I guess, when we think about how the human brain works, we recognise that in humans that the human brain has to operate in a relational environment. Certainly there are many cognitive and memory skills that we do quite individually, but to be successful human beings, we have to be able to form and maintain relationships with each other, and we have to be able to do that in a fairly harmonious fashion. I was reading something the other day that made the observation that that human beings are different from every other species on Earth because we're the only species that you can load into the economy section of an aircraft, leave them there for 12 hours on a long-haul flight and know that they won't kill each other. Now, you couldn't do that with any other species, could you? And you might feel like being homicidal towards some of your fellow passengers after 10 or 11 hours, but that's a pretty remarkable evolutionary achievement, isn't it? That we can sit in that confined space for 12 hours and pretty much behave in a respectful, tolerant fashion towards each other. So the social brain is a very important evolutionary concept. I'm not going to spend time talking about language and culture. I want to acknowledge that language and culture are intrinsically related, and obviously that's fundamentally important for us as a profession to have a respectful understanding of sociolinguistic factors in relation to everybody that we work with. Language competence, though, is a lifespan issue, we obviously need to have the kinds of early developmental experiences that equip us with appropriate syntactic and phonological and semantic systems that then allow us to build and evolve our language skills and our literacy skills right across the lifespan. And I was reminded of this recently talking to my 90-year-old father when we were trying to work something out. I can't remember what it was. and he told me that I should go and Google it. Now, my father wouldn't know a computer from a microwave, but he does know that in this modern world, when you need information, you do something called Googling it. And he used the term completely appropriately, and he knew that I'd be able to find out that information. So at 90, his language is still evolving, and we're all using lots of words, aren't we, thanks to the computer age, that we weren't using 10 or 15 years ago, or we're using the same words in a very different way because now they have very different meanings. Now, the transition to literacy is profoundly important, as you know, but it's not biologically natural. And I think, again, this is something that we intrinsically understand, but it's something that we need to have careful conversations about with our colleagues in other professions. If you're born with, essentially all the equipment that you need for talking and listening, and you're exposed to adults who talk to you and around you, to some extent or another, you're going to learn how to talk, because that's a biological given, in a sense. The transition to literacy is a social contrivance. It just happens to matter enormously in in most cultures. Someone decided at some point we really should write some of this stuff down and hand it on and share it around, and it happens to be the foundation of most educational systems. But it doesn't occur on its own. It requires years of specific and prolonged instruction. It builds on the psycholinguistic competencies that in many cases, well, in most cases, perhaps even in all cases, children have to acquire before school entry. So children have to arrive at school with reasonably well developed vocabulary, phonological systems, phonemic awareness, an intrinsic sense that words are things that go together to express meaning and change meaning, the ability to use narrative skills to share experiences, to tell stories of their life. They're skills that you all know that we can test for and we can benchmark and we can assess. If children do manage to cross the bridge to literacy, we know that that is profoundly important for academic achievement. Very difficult to achieve academically at school if you haven't crossed the bridge to literacy. We know it's important for school attachment and retention. We know it's important for positive self-esteem. So if we think about young people in a risk and protective factor framework, which we often do in relation to adolescent mental health, it should be no surprise to us that when we look at lists of risk factors and lists of protective factors, we'll always see academic achievement at the top of a list of protective factors, and we'll always see academic difficulties at the top of a list of risk factors. Until perhaps the last 10 years or so, though, nobody's kind of peeled the onion on this notion of academic achievement. We've got as far as literacy skills, but we would argue that you've got to peel away another layer of the onion and say, well, what underlies the transition to literacy? What underlies the transition to literacy, of course, is good oral language skills, because the transition to literacy builds on those talking and listening skills that children take to school. There's a couple of important principles that come out of the reading literature. One is about the distinction between learning to read and reading to learn. And in our system in Victoria, the first year of school is called PREP, which stands for preparatory. Then we have grade 1, grade 2, and those 3 years have a specific focus on learning to read, teachers spending a lot of their time on reading instruction. Children go away at the end of grade 2 for their summer holidays, come back into grade 3, probably expecting something fairly similar to what they've experienced for the last 3 years, but no, it's all different now. Instead of the teacher spending vast amounts of time on teaching us all how to read, now we're expected to use our emergent literacy skills across the curriculum to do a project on animals in Africa, or study the solar system, or flags of the world. So now we've got to use these emergent literacy skills. And of course, for children who've crossed that bridge, that's a very happy and natural transition. But it never surprises me when I talk to audiences of primary school teachers and they tell me that this is the point where problem boys really make their presence felt in the classroom, when they haven't made the transition from learning to read to reading to learn, and what they've got in their toolkit is disruptive behaviour. The other important concept that comes out of the reading literature is this idea of the Matthew effect, which many of you will have come across, and that's a biblical reference to the idea that the rich get richer and the poor get poorer. So children who enter school with well-developed foundational oral language skills, talking and listening skills, are ready to make that transition to that biologically unnatural code of reading and writing, and they take off, and ironically their oral language skills receive a top-up benefit because they're exposed to new words for the first time through the medium of text. And the biggest clue to that happening is that children mispronounce words the first time they use them because they've only ever read them. And the children with less well-developed oral language skills, who weren't usually apparent to anybody when they entered school, because they had enough everyday talking and listening skills to kind of fly under the radar. I sometimes say, it's a little bit tongue-in-cheek, but you know, in some respects these kids would be better off starting school mute, because people would notice then that there's something wrong. But if you've got the basic kind of everyday conversational scripts, you probably won't come to people's attention until the end of that first 3 years of school, when you haven't got to where you need to be and you're not able to transition from learning to read to reading to learn. So what do we know about learning to read? We know that it is fundamentally a linguistic task. We know that a child's oral language skills, particularly vocabulary, comprehension, narrative skills, phonemic awareness, are important prognostic factors at school entry. We know that effective evidence-based instruction promotes optimal educational outcomes for all children, regardless of their socioeconomic advantage or disadvantage. And unfortunately, we also know that it is the subject of an ongoing ideological battleground, and it's a little bit beyond me as to why evidence doesn't resolve this battle in the way that evidence seems to be so good at resolving debate and dilemmas in health, in medicine. We defer to evidence much more readily than we seem willing to do in this area. Maggie Snowling and Charles Hume, in a paper in 2011, used a term that I think really should resonate with us as speech-language pathologists, because they've really taken the idea that psychologists for years have been studying children with reading difficulties, speechies have been studying children with so-called specific language impairment, and if we put them together, oh look, they're actually one and the same, but we've been looking at them at different developmental points. And so they use this term homotypic comorbidity, and they said that a reading disorder is simply a later manifestation of what was observed or not observed in many cases, and that's my annotation, as a disorder of spoken language development. And I think that's been quite an important kind of watershed that we've reached in the last couple of years, that we've realised that the psychologists have been busy over there and the speechies have been busy over here, and we've kind of been knitting the same jumper, and they've been working on their arm and we've been working on our arm, and now we put it all together and we've got something that looks much more coherent. So the child on the right is you. You as a profession need to be a little assertive about grabbing back an area that I think you need some serious ownership of, and that's the area of literacy education, teacher training methods. If we accept, as I think we must, because this is an area where there really is a profound degree of coherence in the research evidence from the UK, from the USA and from Australia, that learning how to read is a linguistic task, then speech-language therapy has to be involved at all stages of how that is done. There's a nice visual metaphor for you, that literacy is they also, Snowling and Hume also said that literacy is parasitic on language. So there's a visual metaphor for you to go away with, that we need to get this literacy parasite fat, and the only way that we can flatten it up is by making sure that children have really plentiful oral language experiences and capacities before we ask them to cross that bridge to that unnatural medium. Now, I sometimes say when I'm talking to teacher audiences, which I do quite a bit, I ask them to consider the metaphor of building a house. And I think that you would agree that if you were to build a house, you wouldn't start with the walls, and you certainly wouldn't start with the roof. We all know that we have to start with the foundations when we're building a house. So if we think of children and their language and literacy as being like a metaphorical house, then we would argue that oral language competence has to be the granite-like foundations of the house. And then the walls, and for walls to stand up and be strong, they can't just sit on top of the foundations, they have to be embedded within the foundations. The walls on one side then can be the transition to literacy. The walls on the other side can be the development of pro-social skills and the ability to form and maintain relationships, profoundly important for mental health across the lifespan. And then we can think about the roof on the house being those things that, having made the transition to literacy and being someone who has good pro-social, interpersonal skills, social skills, can form and maintain relationships. The roof over that house then can be academic achievement, a sense of positive self-esteem and attachment at school, a sense of belonging at school, being socially engaged, being inside the social margins, not outside the margins, and exiting school at whatever point with marketable employment skills, because that's what we want for all young people, isn't it? We don't have to have everybody going to university, but we do need to have young people being able to develop marketable employment skills. And increasingly in our Western cultures, first world cultures, that means having to undergo some form of formal training. So if not university, some level of certified training. And it's very difficult to even get into that, let alone manage the demands of those training programs without adequate language literacy and numeracy skills. Many of you would be familiar with the work that was done by Hart and Risley in the United States in the mid-90s, where they took tape recorders into homes where there were 2 to 3 year olds and recorded over a couple of weeks the amount of language that children were exposed to. And what they found was that children of professional parents were hearing about 2,000 words an hour, children of parents on welfare benefits. There were no child protection issues in those families, but they were just on welfare benefits, were hearing about 600 words an hour, and children of working class parents were somewhere in between. Now, this research was of interest to us when we set off on our path looking at language skills in young offenders, because of course we know that unfortunately young people who end up in the youth justice system tend to come more from the lower end of the socioeconomic spectrum than the upper end. So we knew that these young people were starting off from a behind position in their early lives. And of course, what this means too is that by the time children get to school, there's something like a 30 million word advantage for the children of professional parents compared to the children of parents on welfare benefits. And you know, even the best early years teachers must struggle to make up that kind of disadvantage when they're all being benchmarked in the same way in terms of children's level of achievement. Hart and Risley didn't stop with a cross-sectional study though. They actually followed these children up into mid-primary school, and they found that, not surprisingly to us, that at ages 9 and 10 there were strong links between their academic achievement and that early language exposure. Bear in mind too that this is quantitative data that I'm showing you. It says nothing about the qualitative differences in the kind of language that those children were exposed to, and you know that there are enormous qualitative differences in the way language is used around children, to and around children, as a function of parent level of education. Whoops, sorry. What does all of this have to do with high-risk young people? I think you're probably forming some hypotheses in your mind. All of these factors that I've listed here are overrepresented in youth justice statistics. I don't think there would be any surprises for anybody there. A lot of these issues are intergenerational. We've already talked about low socioeconomic status. Many young people in the youth justice system have some kind of developmental disability, although it's often not formally diagnosed. And many of them come from, somewhat chaotic households where there's not always both biological parents present, and that degree of emotional attunement isn't what we would want it to be in a developmental sense. You may be familiar too with research that was done in Victoria about 10 years ago by the Centre for Adolescent Health at Melbourne University, where they did an audit of coronial records in Victoria and looked at patterns of death in young people in the youth justice system in Victoria. And they found that if you're a young male offender in Victoria, you're 9 times more likely than a non-offending male to die before the age of 21. And if you're a young female offender in Victoria, you're 41 times more likely than a non-offending female to die before the age of 21. So that to me says profound health risks attached to being so marginalised that you're in the youth justice system. Many people though, and I think it's the case for most of the people here today, wouldn't have thought of those same risk factors through a different lens, which is saying, well, what do they mean for language development? So it's the same slide, just inviting you now to think of it in a different way. And as you know, all of those things on their own bode poorly for language development. Now, I've highlighted their history of behaviour and conduct disturbance because that's often the one that people do recognise. We notice children who have behaviour difficulties. Why do we notice them? Because they disrupt our day. And Nancy Cohen made this point very profoundly and eloquently in one of her papers when she said that, and she's in Toronto, she did a study of boys referred to a local child and adolescent mental health service by schools, and they were referred because they had behaviour problems, externalising behaviour problems, and they assessed them, found, not surprisingly to us, more than a third of them had a clinically significant language impairment. And she said, well, children find their way into the service delivery system by virtue of what the key adults in their world see as the primary handicapping condition. And if you're a child with behaviour difficulty, it might not matter that your language and literacy skills are poor. What matters to parents and teachers is that your behaviour is disruptive. But the problem is that if you enter the service delivery system through the behaviour door, then you might stay in the service delivery system with a behaviour label on you, and people might not say, well, let's do a full developmental assessment and see what else is going on here. And that was really the take-home message from that study, that she said psychologists and speech pathologists really need to work closely on these kids who are identified because of behaviour difficulties, because very often they're also going to have language and literacy difficulties. Now, the research on the language skills of young offenders is really picking up momentum around the world, and the nice thing, I think, is that we've been able to move beyond the kind of ho-hum, yes, they have poor social skills, yes, they have poor literacy skills. That's kind of been known for a long time. When we set out in this research, we really were wanting to ask, I guess, how much those difficulties with social skills and difficulties with literacy kinds of tasks might have a common underlying causal pathway, or at least contributory pathway, that related to oral language skills, and particularly unidentified language impairments. Overall, we can say that 50 to 60% of young offenders, particularly young male offenders, we can be more confident there, have a clinically significant but previously unidentified language impairment as assessed on a standardised measure. In Victoria, just to give you a little bit of context for our research, we have an unusual dual track system, which means that older young offenders can be maintained in the youth justice system rather than going directly into the adult correction system when they're 17 or 18 at the time of sentencing. So it sits quite nicely with developmental principles, I think. We don't have as many Indigenous offenders as other states, but we don't have as high an Indigenous population in Victoria as some of the other states. Our most recent study was a custodial study. We had done 3 community-based studies, and for a range of reasons we wanted to study a custodial group. One of the main reasons for that was that we wanted to look specifically at the possibility of a relationship between language impairments and a history of violent offending, which we hadn't been able to answer from our community-based samples because there were not enough young people on community-based orders who had convictions for violent offences, as you might expect. So because this study was carried out with that sort of senior group of older young offenders, their average age is a bit over 19, I'm very happy to give you copies of papers or tell you more about the specific measures that we used, but you can see a bit of an aerial view there of the territory that we covered. We obviously included non-verbal IQ, a measure of mental health. We quantified offence type and severity using a scale that was published in Canada specifically for that purpose. So we've got quantitative data on convictions, not just qualitative data, and the other things that you can see listed here. Now, in this study, we used a, I think, unreasonably conservative cutoff, and we identified, we were expecting that it would be more, but our cutoff, our criterion was that they had to be underperforming on 2 standardised language measures, which were, in this case, were the self and the test of language competence. If we'd made it one or the other, it would have been 68% of the sample would have been language impaired. The deficits were across the board, so when we look at their profiles, they're quite profound levels of difficulty with respect to both receptive language skills, expressive skills, narrative skills, abstract metaphorical language, vocabulary. Really nothing seems to be spared in this particular population. We couldn't account for the language problems on the basis of low IQ, so it's not just a matter of someone being able to say, well, look, these kids just aren't very bright, so what would you expect? And interestingly, of those who we identified as having a language impairment, because we got detailed developmental histories from them, most of those who were identified as language impaired told us that they had special services in the early years of school. So it's not that schools, and I don't mean to sound like I'm banging out schools, we have a collective responsibility here as a community. It's not that we as a community don't know who the vulnerable at-risk children are, we just tend to under-intervene, unfortunately, at that developmentally appropriate point. In those young people who'd had a period of out-of-home care placement, so they actually had to be placed in foster care or in other forms of state care, 62% were identified as language impaired. Overwhelmingly, they formally departed school around years 8, 9, 10, but they had really departed school much earlier than that in terms of true engagement and in terms of their mastery of curriculum content. Virtually none of them had anything that an employer would get excited about in terms of a skill set that would meet requirements in the open market. And what we did find here was a significant association between a history of violent offending and having a language impairment. Now, I won't spend a lot of time talking about how we did this, but we basically did a median split on those quantified offending scores, and that created 74 out of 100 who we called, or 26 who we called high based on their histories of violent offending. And 74 who we couldn't call low because they were locked up young offenders, so we called them not high, just to be perverse. And those 2 groups differed on years of education, so the ones with a pattern of more severe interpersonal violence in their histories had completed fewer years of formal education. But then we compared them on our language measures, and what you can see here down the left, they'll all be familiar to most of you, those subtests, and you can see the high offending group in blue, the not high in grey. The mean scores, you can see, were lower on all of the language measures for the high offending subgroup, and the ones that are in red were statistically significant. The one in orange approached significance. So we were able for the first time to show that there is an association between a pattern of a history of interpersonal violence and the likelihood that there's a language impairment. And I think that would make intrinsic sense to this audience, that if you don't have verbal skills, we know that young offenders, if they're faced with ambiguous social cues, if one possible interpretation is a hostile one, they will tend to favour the hostile attribution. And so if you've already got a preference for a hostile attribution and you don't have very good verbal skills, then an otherwise benign exchange is going to escalate to something quite toxic and damaging quite quickly. Now, lots of limitations to our research, as with all research. The one that we're most self-conscious about is the lack of young people from Aboriginal and Torres Strait Islander backgrounds, but that's something that we're addressing right now in the study that we're doing in New South Wales. And we also, until now, didn't have data on young female offenders, but we're also addressing that in New South Wales. Now, I just want to say a little bit about this interface, this important interface between child protection and youth justice. In Victoria, as in all places, I think there's a significant proportion of young people who enter youth justice via the child protection door. And there are some young people who spend a number of years kind of ricocheting between the two services. In a study that we've just completed data collection on in Western Australia, we've looked at, again, using formal language measures, the self and other appropriate measures, looked at a sample of 80 children aged 5 to 12 in the child protection system. So these are children with verified maltreatment issues, physical, sexual abuse, neglect, often quite complex maltreatment histories. And what we've found on first pass look at the data is that 25% of those children have a language impairment on formal testing. When we compare them with an SES matched group, they had 17% of them had language difficulties, compared to somewhere around 10% in the general population. So some of these children, I guess, will go on to enter the youth justice system, some of them won't, so some of them will be on that trajectory. So again, conservatively 25%. There's a whole discussion around what that means for those children then when they're taking part in investigative interviews about alleged abuse. You know, what are the skills that interviewers need to have, and how do we need to train interviewers and make sure that we're not training them around normal language development when they're trying to elicit a narrative account of an alleged abuse incident, when these children don't have typical language development at all, and they have quite uneven language profiles. So what does all of this mean then for what are the implications? What's the so what aspect of our research? Well, we think that there are implications around early intervention. I guess, and this might be a little bit provocative, but I think the biggest population level early intervention that we have for children from the age of 5 onwards is going to school. Education is a public health intervention, really, isn't it? It's designed to improve lives. It's not just something that's designed to occupy children's day and be free childcare for parents. It's actually designed to improve people's lives. So we need to think about what we do for these high-risk boys who make their presence felt through that combination of behaviour and learning difficulties. We need to identify ways of strengthening educational attachment for this group. I do feel very strongly about the application of evidence-based instructional techniques in all classrooms, that it shouldn't be a matter of whim or ideology or belief systems for people about how reading is taught. If we expect evidence to be applied in health and medicine, when we go to the doctor, We don't want the doctor to say, well, look, you know, there's probably some better ways of treating your particular medical condition. And I know there's been some research done on this since I was at university, but personally, what I believe is X, Y, Z. That's not what we expect of health professionals, because we have a view that what health professionals do is so important that they need to be driven by evidence. And I would argue that what teachers do is so important that they need to be driven by evidence as well. Forensic interviewing, coping with a police interview. And a police interview can be something that you have on the side of the road late at night when a police car stops and asks you why you're standing near that car, you know, with a screwdriver or something else that looks suspicious, and you've got to then use your narrative skills to account for yourself and your actions. Understanding court processes, bail conditions. How many young people breach bail simply because they didn't understand the terms of bail that were delivered to them verbally in a highly stressful situation? Restorative conferencing, and you know, this is something that I think has been a really significant improvement on old adversarial approaches to youth justice administration that were highly punitive and frankly not particularly successful. However, restorative conferencing, asking a young person to sit down in a highly verbal conversational exchange that's emotionally charged and means a lot to the other people who are present at that conference. We're asking them to display authenticity and genuineness in apologising for their actions. We don't know yet to what extent unidentified language impairments really hinder the success of those conferences from the perspective of the victims, who obviously go along with an expectation that they're going to hear something that sounds authentic and genuine and remorseful. Then what does it mean for young offenders once they're in the system? Clearly I think there's an argument around developmental assessments of children in the child protection system, and to some extent that happens in Victoria, and what doesn't get much more verbal than sitting down with a very verbal psychologist and being invited to think about your thinking, and you know, having those linguistic and meta-cognitive skills just may be a bridge too far for many of these young people. And you know, we can think about that too in relation to specific interventions that sometimes need to be offered. Literacy programs for young people in the justice system. On the face of it, I think they're a fantastic idea, and what a good way of trying to capitalise on that time for young people who are completing custodial sentences. However, if at least 50% of these young people have an unidentified language impairment, and they didn't make the transition to literacy the first time round, and they've still got their language impairment when they're 15 or 16, but now they've also got some very negative baked-on attitudes about education, learning and self-esteem and failure. Why are they going to make the transition to literacy this time round if we're just doing what we did last time? So our data suggests to me that we need to be approaching literacy via the oral language door and strengthening underlying oral language skills at the same time as working on literacy. Now, I'm conscious of time, and I said I'd tell you a little bit about the ALSEL trial in Victoria. This has, it's actually no longer in press. It came out last Saturday as an early online paper. This was a randomised controlled trial conducted in 14 disadvantaged schools in Victoria. 8 were randomly allocated to the research arm, 6 to the control arm. And the focus was on children's language and literacy skills in the first 2 years of formal schooling. We started with an initial sample of just over 1,200 students. The intervention didn't go anywhere near the children, though. The intervention focused on the teachers and what the teachers knew about the psycholinguistic basis of the transition to literacy, and we gave the teachers skills that they could employ in their early years classroom, and we engaged with the teachers over the trial went for 2 years. We had engagement with the teachers over an 18-month period, around changing their knowledge and skills. The focus of the teacher PD was on how to develop vocabulary, phonemic awareness, narrative skills, and using and understanding more complex sentences. There's a lot more to evidence-based instructional techniques than phonics. Phonics is a small component of what the evidence tells us that we should be using. We took baseline measures at 2 time points, and we found significant gains for children in the research schools on both oral language measures and on literacy measures at the end of 2 years. They were all disadvantaged schools. There were high numbers of children from language backgrounds other than English, and significant proportions who were receiving educational maintenance allowance, which means that their families were particularly poor, even within the context of being in a disadvantaged school setting. So that is that's RCT evidence that tells us that skilling up teachers around the psycholinguistic basis of the transition to literacy produces significant and robust outcomes for children. So I guess for me, we've got a bit of a logic sort of conundrum that we need to resolve here. We know that oral language is important. I think we can accept that oral language is important for the transition to literacy in the early school years. We know that strengthening oral language in the early years improves literacy outcomes. We also know that literacy outcomes promote educational success, and educational success is a protective factor for all young people. We don't just want young people from comfortable, cosy, middle-class families to succeed academically. We want everybody to succeed academically. As a society, we need to pick up the tail of the curve and move it to the right. So how do we move forward then for vulnerable adolescents? 1 in 2 young offenders has a significant oral language deficit. How can we strengthen both their oral language skills and their literacy skills? And are literacy-based interventions enough? And I guess it's a rhetorical question, and you'll answer it in your own mind. I'd like to just very briefly touch on what we've learnt in the last decade, not we personally, but us as a research community, clinical community have learnt in the last decade or so about the neuroscience, about the development of the human brain, particularly adolescence and into early adulthood. Many of you would be familiar with the fact that we now know that the prefrontal regions don't finish their myelination process until well into the mid-20s. What a relief for parents of 18-year-olds to know that there's more yet. You don't have to shut up shop and think this is as good as it gets. We know for young males that myelination process goes on until about age 25, for young females till about age 23. And of course, what does the prefrontal cortex do? It plans, it organises, it regulates, it curbs impulsivity, it thinks from another person's perspective. All of those higher order cognitive and metacognitive skills. So I think this evidence means that we need to be, the term I've been using this week is aggressively optimistic about young offenders. If we're looking at a troublesome 15 or 16-year-old, we're looking at someone where there's still another decade of myelination and maturation of neural pathways to take place. Their life experiences are going to shape those neural pathways. Are we going to be part of that shaping and try to have a positive effect on that shaping process, or are we going to leave it to their otherwise chaotic, unpredictable and traumatic lives to shape those neural pathways? Because they're going to be shaped one way or another. We know that impulsivity peaks in adolescence, and so that's why for some young people being in a secure facility, either in child protection or in youth custody, actually provides some kind of sense of stability for them, because that if they haven't had boundaries and parental boundaries and attentive, authoritative parenting, it can actually be very reassuring to have that natural impulsivity curbed by being in a secure facility. But that obviously is not the only reason that we would use that response. We know that alcohol has a particularly neurotoxic effect on the developing brain, and we also know that trauma, as I've said, weaves itself into the sculpting of those neural pathways, but those neural pathways continue to be shaped well into adolescence and early adulthood. So we need to remember that children who have language deficits, impairments, disabilities, whatever your terminology, will grow into adolescents who still have those language deficits, impairments, disabilities, but we'll notice them for other reasons. We'll notice them because of their mental health problems, internalising, externalising issues, poor attachment to school, being particularly grumpy and unhappy about being at school. But then they'll grow into adults who still have language impairments, but then they're much, much harder to differentiate from everybody else, but they turn up in unemployment statistics and in public housing statistics and mental health services and drug and alcohol services. The Industry Skills Council of Australia published a report a couple of years ago in which they said literally millions of Australians have insufficient language literacy and numeracy skills to benefit fully from training or to participate effectively at work. We can't afford to have a workforce where literally millions of us don't have adequate language literacy and numeracy skills to engage at work, particularly when the nature of work is becoming more rather than less technological and requiring higher levels of education, not lower levels of education. Boys who have these behaviour problems and learning difficulties need to be raising red flags for us about their developmental needs, remembering that behaviour problems in children and adolescents are not developmentally normal. And I think this is a conversation that's worth having with our teaching and education colleagues. It's very easy to cast a child in a particular light and not be asking about what that behaviour is communicating to us, because all behaviour is communication, and in many cases children are communicating skill deficits to us through their behaviour. So adults unfortunately can be blindsided sometimes by difficult behaviour and not see that developmentally there might be some other complex language learning trauma issues underlying that behaviour. We need children to be able to use language to talk about feelings, and some of you may have come across this term that I think is a really valuable and important one, alexithymia. And if you deconstruct that word, you know that A as a prefix means lack of, lexi means words, and thymia means moods or feelings. So alexithymia means lack of words for feelings or emotions. And we know that the ability to talk about feelings, which is one of the things we ask young people to do when they take part in a family group conference, isn't it? They've got to sit and talk about their own feelings. They've got to recognise other people's feelings and be prepared to talk about those as well. But increasingly we're getting a sense that alexithymia might occur in a lot of young people who have a trauma history. It certainly occurs in young people on the autism spectrum, and it's something that we're actually assessing for in our current study in New South Wales. We're actually using a standardised measure of alexithymia so that we can look at that data alongside our other language data. But it's something that is perhaps not as well known as it should be, but I think it helps to flesh out our understanding of some of the complexities that these young people experience. So what we need to tell our colleagues is that language problems are real, but they're invisible. These young people, they don't have a barcode on their head that makes a noise when they walk into the room to alert us all to the fact that they have a language difficulty. But instead, language problems tend to masquerade as other things that cause disadvantage for these young people. They masquerade as rudeness or indifference, motivation issues, suggestibility in an interview context, or acquiescence, that tendency to agree with propositions that are put to you by an authority figure simply because you sense that there's a social pressure to agree, that it would be expected of you that you agree with the proposition that this police officer or legal counsel is putting to you, and you already feel uncomfortable enough and you're trying to escape this excruciating interaction. So perhaps if you just agree with everything, they'll like you a bit more, and this horrible interchange will end a little bit sooner. Of course, language problems sometimes masquerade as low IQ, but most worryingly at all, they don't get on people's radar, and that's really the job that you have as crusaders, to get out there and inform and educate people in other disciplines about the pervasiveness of language difficulties. This is a provocative quote, but I think it's really valuable in the context of getting engagement of relevant stakeholders. Rod Morgan was the chair of the UK Youth Justice Board, and he said at one point that it may be too much to say that if we reformed our schools we'd have no need of prisons. But if we better engaged our children and young people in education, we would almost certainly have less need of prisons. Effective crime prevention has arguably more to do with education than sentencing policy. So when I talk to audiences of teachers, I tell them to go out there and tell people that they work in crime prevention. When someone says, "What do you do?" You say, "I work in crime prevention. What do you do?" Because when education does its job well, for all young people, regardless of the risk factors present in their community and their family, that does have a crime prevention outcome, and that's good for all of us. So I guess what we're on about is trying to prevent this trajectory from this problematic young person who we can so easily characterise as being a behaviour problem, and just think about in that one-dimensional kind of way. But the person on the left is, it's much easier for us to change the trajectory of the person on the left than it is of the person on the right. However, that's not a get-out-of-jail-free card for any of us. The evidence on the later development of the prefrontal regions tells us that we should continue to be very creative and assertive and empirical in the way that we go about designing interventions and evaluating them for those young people. These young people are going to cost us as a community one way or another. So how do we want to invest in them? Do we want to invest in building prisons and in having more police out on the beat? Or do we want to invest in finding ways back on track, back into the mainstream, so that these young people don't have to continue to be involved in antisocial activity and crime, but can develop pro-social skills that allow them to become part of the mainstream, to get a job and feel good about themselves and not be on the margins. Now we've published quite a bit out of this work, and I'll be very happy either directly or via Claire, Sally or Linda to share copies of those, and I'm also very happy to take questions, and I thank you for your forbearance in a fairly long presentation. So thank you.
Thank you, Pamela. Once again, I get the delightful job of thanking her. And also, I'm just going to open it up for questions. We've got time to answer a few questions. We've also got something to eat and drink at the back afterwards if people want to stay and talk some more and ask questions just of Pamela that they don't want to ask in front of a big group. But we're very happy, and Pamela's obviously graciously indicated that she's happy to answer questions. So has anyone got anything they would like to ask, or doesn't feel nice, mate?
Thank you for your speech. I have a question. How did you get into the justice system?
Because in my country, it's kind of so protected environment.
It wasn't easy. For those of you who may not have heard the question, how did we get into the justice system? A lot of slowly, gently, finding out who were the right people to talk to, getting lucky in having a conversation with a senior youth justice regional coordinator who got it. When I went to her and explained what I wanted to do, she started rattling off examples of verbal interactions that she'd had with young people, and she was having light bulb moments as I was talking to her, and she said, "Yes, I will give you access to young people in my service." Yes.
It looked like across your different samples and all your measures that you had fairly universal difficulties across
across different kinds of language.
Yep.
And disease, and I wondered if there was any sort of hopeful glimpse in any of your samples where there was some factor that protected young people for some aspect of language that might be something that you could build on?
Look, that's an excellent question, Suzanne, and to be honest, I think, we need to go back and look a bit more at the young people who we didn't identify as language impaired and see. I can remember having a bit of a look in the data in the last study and nothing kind of leaping out at me. They were, from memory, fairly undifferentiated. But it's a good point and it's worth going back and having another look at. But you're right, the language profiles themselves are pretty flat. And as I was saying to some folk earlier, on the test of language competence, which you may or may not be familiar with, looks at figurative language, ambiguous sentence, metaphorical kind of language. I had some real misgivings about using that at the outset. I'd used it in my brain injury research, and I can remember thinking, oh, this might just be a bit too clinical for this group. We might not find very much. But today, if you de-identified the data, and I didn't know which one was brain injury and which one was young offenders, I wouldn't be able to tell them apart, because the young offenders just gave exactly the same kind of response patterns that adults who had brain injuries gave. It was really quite confronting.
Can I ask if you checked the incidence of hearing loss in those?
That's another good question. We didn't actually assess hearing, but in our last study of the 100 young people serving custodial sentences, we did ask them, and I know that that's not conscious of the audiological expertise in the room. I know that that's not enough. We weren't met with sort of terribly enthusiastic responses about being able to have access to a room in a secure facility that would be quiet enough and safe enough for our research assistant to be able to assess hearing. And in the end, that was the stumbling block. But we did ask them about whether they'd ever had hearing difficulties. 4 out of that 100, I think, said yes. None of them, interestingly, turned up in the language impairment group. But yeah, I don't know that we can make too much of that and with such a small number. But yeah, it was the logistical, practical problems of having a space that was quiet and safe where we could do even pure time screening. The research assistant has to be in a clear line vision of a member of the security staff at all times.
But it's being done here. Sarah, do you want to mention what you're doing?
Oh,
Yes, yeah.
yeah, I'm doing some PhD research on looking at hearing, auditory processing and language skills of youth offenders in 2 youth justice residences in New Zealand. So what I have done pure tone audiometry testing, and I must say I was completely naive about how safe or dangerous it might be. I just went, well, I'll do that.
Sometimes naivety is a good thing.
Yes, I know. On reflection, I thought actually it was quite dangerous. But what I have found in the data I've seen so far is that there is a significantly worse hearing in the group of the controls that I've tested. The auditory processing hasn't been particularly different so far, and the language skills again significantly worse. So it really reflects what Pamela and other studies have shown.
Mm.
So you should say it hasn't been particularly different, but it hasn't been particularly good either.
No,
For the
no.
auditory processing.
Yeah. No, it hasn't. Auditory processing is still not very good.
Thank you. Claire, do you have a question?
Yeah, I just wondered if you could tell us about the reaction you get from secondary school teachers when you talk about.
I think primary school teachers engage pretty readily and easily with our message. I think it's much harder for secondary school teachers because of the way secondary schools are run and organised. I don't think, well, certainly in Australia, I don't think we're well down the track of really looking at language-based interventions for adolescents, or language and literacy interventions that have a language focus for adolescents who continue, shock horror, their difficulties don't go away when they transition from primary to secondary school. We probably haven't spent, I probably haven't engaged with secondary audiences nearly as much as I have with primary ones, because they're the ones who've shown interest in the work. But I think the secondary environment is a lot more complex in terms of things being more differentiated organisationally. But if you look at, say, mathematics, that's a very verbal part of the curriculum. So, the findings are no less relevant to the secondary sector, but we haven't really engaged in ways that we should have. And there is some good work being done. Some of you might be familiar with Julia Starling's work in Australia, where she started to intervene in secondary settings around language competence. She published an RCT in language, speech and hearing services in schools last year, I think. So there is some work starting to happen in that area, but I can't claim any credit for progress in that area.
Oh, one more question. Thank you. There you go.
Yeah, similarly, I'm really interested to know what responses you got at this time yesterday. What was their background knowledge before they came in, and what was their responses after, and did they have any suggestions or requests that might be useful for us?
Sure. I guess I can't speak with any authority about what their background knowledge was before they came in. I certainly felt that the audience yesterday engaged really well and was very receptive. I think there was some frustration expressed around the difficulties of accessing specialist services when they're needed, i.e. you guys. But I thought that there was an enormous willingness and an enormous amount of goodwill to try and get on board with trying to change practices and policies. And perhaps Claire and Sally and Linda might have a view on that as well, but I didn't get a sense of resistance. More frustration, I think, that it's that there is a recognition that SLTs have the expertise in this area, but it's often difficult for people in other disciplines and in other sectors to tap into your expertise.
Yeah.
And hence talking trouble, I guess.
Yeah.
Your talking trouble's going to fix it. Okay, by next week.
Thank you, Pam. I get to give you a present that's apparently being squashed.
Oh.
But it doesn't matter that it's squashed. It's just on the outside that was squashed. So thank you very much. We've been absolutely delighted to have you here. Thank you.
Thank you.